Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, here for another one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. I'm a psychiatric nurse practitioner who spent 13 years in the hospital working in all of these areas. And I have a lot of experience with this, which is why I started the channel. So I'm so grateful you guys are all here. Please remember to like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator, and YouTube really likes it when we get more subscribers. Remember, we're also on Facebook and Instagram for additional content, so you can check us out there, and make sure that you guys send your friends and family our way because we really appreciate that. One of the things I like to do during here is I like to answer your questions live. So if you guys have any questions that you want answered, please feel free to put them into the chat. I'm going to go ahead and I'm going to actually get to some of the questions that we had put onto the channel, like onto some of the videos this week. So let's see. So we had actually a really good one on the bleeding video. And it's actually a very long question, but it's a very good one. So I have a UTI that seems to have reached my kidneys. My baby is 4 weeks and 3 days gestation, and I've been experiencing on and off bleeding for the past 2 weeks. At first, I thought it was implantation bleeding. I did have an extreme headache and nausea around that time. I also thought the pain in my belly was round ligament pain, but then I developed a fever when the baby was 4 weeks along with sharp belly pain. I had I think it's a urine, just like a regular urine test and culture, which showed 3 to 5 pus cells, epithelial tissue, calcium, and protein. The culture result was mixed, so I needed to retake the test. The last 2 nights, I've had bleeding again, which always happens after midnight. I've started taking Dufistan 3 times a day instead of 2. If I have kidney damage, could that be causing bleeding? Can a urinary tract infection cause bleeding? I have to go again for an ultrasound at 5 weeks. So this is a great way to start out. A lot of times we have a lot of questions on the bleeding video because the bleeding video, bleeding in pregnancy is very scary, right? And so I talk about it a lot. There's a whole bunch of reasons why you could bleed, but one of them could be infection. So the answer to this is yes, urinary tract infections and kidney infections can cause bleeding, but you're usually seeing bleeding from the urine, not bleeding from the vagina. So it's very important to clarify that. And usually you're only going to see tiny drops at most. So if you see red bleeding, that's coming from the vagina. That's something different. Urinary tract infections can be devastating to a pregnancy. They can cause preterm labor and miscarriage. So it's extremely important that you get your urinary tract infection treated. So a urinary tract infection, if left untreated, goes into the kidneys, and that's something called pyelonephritis. Pyelonephritis can cause a systemic infection called sepsis, and sepsis can lead to organ failure. If you get sepsis, that's a blood infection, right? Well, what are we giving to your baby? We're feeding your baby blood, right? And so that septic blood can go to the baby, which is what causes those complications. So it's extremely important that we avoid that. That means when we're at a urinary tract infection, which is an infection down in the bladder, we're treating it with the proper antibiotic until it's in order to avoid it even going up into the kidneys. And that helps to reduce the risks of all of this stuff. If you guys are having urinary tract infections and you're being told to take an antibiotic, you really need to consider this. A lot of people want to treat a urinary tract infection homeopathically. There's a lot of misinformation out there that you can even do that. And normally, I'm very homeopathic. I like that kind of stuff. So I can understand why people want to do that, but you can't mess around in pregnancy. When you're pregnant, you're immunocompromised. Your immune system would attack your pregnancy if it was at full-fledged, like, overdrive. But it's kind of muted during pregnancy. And so if you've ever been pregnant before or heard about all your friends, you probably have seen it. Pregnant women get sick like over and over and over again. And it's the running joke because you can't take any medication while you're pregnant. You can't take Dayquil or NyQuil or any of that stuff, right? So the reason why you're getting sick so often is because your immune system is compromised. And so what needs to happen there is you need to make sure you're keeping yourself healthy. Well, anything that could make you sick will be worse, like a urinary tract infection can be worse. One of the reasons why we talk so heavily about the flu vaccine and the COVID vaccine for pregnant women is you're more likely to get those diseases and you're more likely to have a severe version of those diseases. So we want to try to prevent that as much as possible. So with a urinary tract infection, like, first of all, once a urinary tract infection is established, you cannot treat it homeopathically. So if you have heard like cranberry juice doesn't treat a urinary tract infection. It is excellent for preventing because it helps to acidify the urine, but it's not going to treat it. And so you need to go ahead and take antibiotics if your healthcare provider is recommending them. And make sure you take them all as prescribed. You don't want to skip any doses and you don't want to stop early because that can lead to treatment-resistant bacteria. The next question, any of you guys who are joining me, please feel free to put your questions into the chat. Is progesterone prescribed before or after a cerclage? I lost my baby at 21 weeks in my last pregnancy and I'm anxious this time. We'll have a cerclage at 13 weeks, but I want to know if progesterone can also prevent preterm labor. So it used to be that progesterone was commonly used for preterm labor, and this has been used for like ever. But one of the things is that some things have been changing, okay? So what happened is that there is a shot called McKenna, and McKenna was used for years for the use of preterm labor. It's progesterone. And they gave it conditional approval by the FDA because it seemed like the original data showed possibilities for helping with preterm birth. Now, since then, the data has come out that it may not be helping. Now, it doesn't seem to hurt, but it's not clear if it's helping. So there's a lot of stuff going on right now. I've heard some providers don't give progesterone anymore. Others are sticking to what they know. What I can tell you is there are some people who will say progesterone with a cerclage actually reduces the risk of preterm labor, and you will find the exact opposite. So really, honestly, this question is going to be very personalized to you. There's going to be a whole variety of factors that could be, a part of that. So I'll tell you that I can't really answer that for sure, but it's oftentimes used together. So, and then for any of you guys who don't know, a cerclage is where we stitch the cervix shut. So this is your uterus, this is your cervix. And a cervix looks like this, long, thick, closed. And the mucus plug sits in this little space like my fingers look like. And when you dilate, the mucus plug comes out. So a cerclage is simply sewing this shut. It's a surgical needle and surgical thread, and it looks just like what you imagine. And then right before, when you're like 37, 38 weeks, they go in there and they just snip that little thread, and then they'll allow you to go into labor naturally. There are risks with a cerclage, so we don't always do a cerclage. It just depends on the situation. But it is something that it is something that is an option, especially if you've had more than one miscarriage or if you've had an incompetent cervix. Okay, so I'm going to go to a question on superfoods. I'm 12 weeks pregnant and I've been experiencing severe gas, digestive issues, and bloating for the past 2 weeks. I can't eat anything because it doesn't get digested properly. I'm very restless and uncomfortable about this. What can I do to reduce it? So, this is a very good question. Unfortunately, when you are pregnant, you oftentimes will have digestive issues. It's very common for you to get gastrointestinal reflux disease or GERD, and also heartburn. That's because a lot of stuff relaxes, and you got a baby pushing up on your belly, and so you get that acid reflux. So again, the baby is also pressing down on different parts of your intestine, which can make things go slower. If you're taking iron can constipate you, and that can lead to some bloating as well. What you need to do is, if you really are having a lot of digestive issues, go to a very simplistic diet, like what we tell people to do when they've had food poisoning. One of them's the brat diet, which is bananas, rice, applesauce, and oh my gosh, I forgot the tea. I am absolutely drawing a blank on the tea. I'll remember it later on. Other things that you can include with that is chicken, like a plain grilled chicken. You can include maybe some pasta. Pasta is also toast. The tea is toast. See, I told you guys I'd remember it. So very kind of bland, basic foods. Green vegetables are like amazing for you guys, but those cause a lot of gas. So if you're having a lot of gas pain, you may want to try to figure out if you can take it in a different way or if you can take less of it. So what you want to do is you really want to try to make your diet a little bit more bland, and that should help. Now, there was a very interesting thing. It said that I'm very restless and uncomfortable. So just so you guys know, restlessness during pregnancy can be caused by iron deficiency. One of the other things that can cause that iron deficiency causes in pregnancy is actually nightmares. So if you're experiencing a lot of restlessness or nightmares at night, you actually want to ask for them to check your iron levels, because that actually could be the reason that's causing it. And then once that starts, like you get iron supplementation, that can actually start to get better. So that's like one thing you want to try. Hi, movie mode. I've had a yeast infection and was given cefadroxil. If you're aware of it, is it safe for use during pregnancy, or it's best to use canesten inserting pills? So I'm going to tell you, I am not familiar with that, but I am going to look at my handy dandy drug guide for pregnant women. While I'm looking this up to see if it's in here, one of the things that you guys want to know, yes, it is in here. So let me tell you about it. Let's start with yeast infections, and then I'll answer the specific question. Yeast infections are very common with women in general. And then, of course, when you are pregnant, I told you, you're immunocompromised, you're more likely to get one. So it is very, very common. Now, we're used to being able to just walk into a drugstore, pick something off the shelf, and treating ourselves. You cannot do that during pregnancy. And actually, your question has one of the examples as to why you need to talk to your healthcare provider. Canesten, I don't know if I'm saying it right, inserting pills. This is basically usually like a little capsule that you insert into the vagina. Now, depending on your pregnancy situation, you may actually be more at risk for other types of infection, and your doctor may not want you inserting anything into the vagina. That's why you've got to ask them. Your doctor may actually want you to take a pill, and they will prescribe that for you. So it's very important that you have that discussion. Your doctor may also want you to use certain types of creams versus others. So make sure you don't use anything unless your doctor has told you about it. So now, cefadroxil, what's the brand name? Oh, okay. Duracef, Ultracef are some of the brand names. So there's no studies on any of this stuff, guys. What it is saying is that in animal studies where they used doses 11 times higher than a human being, there was no evidence of issues with the baby. This is considered probably safe for pregnancy. So let me explain what probably safe means. So there is a pharmacist by the name of Thomas Hale, and Thomas went ahead and he created this like classification system for medications, both related to pregnancy and to lactation. And he's aggregated together, and he also does the infant risk line. So what it is it takes into account animal studies, half-life, molecule size, administration, studies on people that aren't pregnant. You can't do any studies on pregnant women or postpartum women or lactating women because it's not ethical. The safety profile for the med, all of it. And he aggregated it together and created a risk scale. And so P1, P2 are considered usually safe for pregnancy. P3 is considered a risk versus benefits, and 4 and 5 are a no-go. So I use this reference to help me make decisions with my patients as to what we're going to do. We have a risk versus benefit discussion. I always let them know exactly what this is saying because it's important for that dialogue to happen. Now, in the case of like you guys asking these medication questions, well, there's other places that you can go, like your local pharmacist. They also have access to databases and other things, and they have training on what's safe during pregnancy or postpartum. And so you can also reach out to them. But going back to the question, that is considered probably safe for use during pregnancy. So if you have a yeast infection, you definitely want to get it treated because it can actually lead to miscarriage. Okay, I had a question on my twin video. I'm a mom of 3 and currently pregnant with monodi twins. Both twins have been cephalic, head down position since 22 weeks, and I get weekly ultrasounds. I'm now 26 weeks. What are the chances that after giving birth, baby B could flip into a breech position? Does an epidural work the same as a spinal? If so, would it be recommended to get a spinal instead? So these are a couple good questions. So I have a video on giving birth to twins. One of the things a lot of people don't realize is that when you give birth to twins, you give birth in an operating room. So you will give birth in an operating room with everybody garbed up as if you're going to have surgery and the full teams for each baby all on board. Because there is always the chance that the first baby will deliver vaginally and the second baby will be required to have a cesarean section, which is why she's asking the question, is it possible the baby could flip? So generally speaking, a complete flip like that is like very rare. I'm not going to say it's impossible. Everything is possible, but that's like very rare because the baby would have to like literally turn upside down. Now, when we have babies that are horizontal, they could go either way. So that one's one that's more like up in the air, but it's kind of not likely. Now, as far as spinal versus epidural. So an epidural is kind of what we all use as the term for the anesthesia, where you get that injection in the back and they insert some medication that kind of numbs you. So the only difference really between an epidural and a spinal is the location in your spine, like where they go. So in the case of delivering the twins, I wouldn't necessarily get a spinal versus an epidural. It's kind of one half. It's the same, really. I mean, they're going to numb you either way if you need to have a C-section. And we use epidurals all the time to do numbing for C-sections, and they work perfectly fine. So I don't think that there'd be any reason to go straight to a spinal. And usually, generally speaking, we go straight to a spinal only for planned C-sections. Or I guess it's an emergency C-section where there was no like epidural in place, like if she had been laboring naturally. So if you're going to be laboring for a while, they're probably just going to do an epidural. So yeah, I hope that answers the question. For any of you guys who have questions, please feel free to put them in the chat because I didn't get a lot of questions this week. So I'm almost done with my questions. Okay, swelling video. All of a sudden, I got leg swelling at 39 weeks. Should I be worried? So I'm going to say yes. Okay. I think we dismiss swelling way too much and way too often. I recently had one of my patients. I saw her at 38 weeks. I was like, man, you look really swollen. And I was seeing her on telehealth. So I'm just getting a partial look at her face. And I was like, man, you look really swollen. She's like, yeah, I'm swollen a little bit. My legs are terrible, but they say nothing. That there's nothing wrong. She gives birth to the baby and she goes home. And 2 days later, she's back in the hospital with preeclampsia. And I have a video on preeclampsia if you'd like to check that out. So swelling to me is like this huge warning sign. Now, could swelling be nothing? Absolutely. You've got a lot of weight on board. You've got a lot of fluid on board. You're at the end. It absolutely could be nothing. But it could be an early warning sign for preeclampsia. And you definitely don't want to get to the hospital with your blood pressure 200 over 160. That's not where we want you to be at. So you want to let your doctor know. Now, one of the things is if you have sudden swelling, this is a big deal. Sudden swelling, like you gain 2 pounds overnight, that's way more worrisome than if you have more gradual swelling. So that's one of the things you also want to take into account. Now, when it comes to swelling, let's assume it's a normal swelling and your blood pressure is normal and you're not having any other symptoms. Treat your legs as you treat a swollen ankle if you sprained your ankle. Put your legs up, walk around, ice, like that kind of stuff, and it will hopefully go away soon. Hi, Renee. How many weeks is the baby full term? 37 or 40 weeks? Love this question. The answer is 40 weeks. Your baby is full term at 40 weeks. At 39 weeks, we'll go ahead and say they're cooked, but if they're 38 weeks or lower, they are a late preterm baby. Why is this so important? Because everybody used to like get induced at like 37 weeks. And now they will not take you until you are 39 weeks. They will make you come in at midnight right before you turn 39 weeks. If you're 38 and 6, you're not getting an induction. So why? The last couple of weeks that your baby is in the belly, there's a lot of brain development that's going on. So those last 4 weeks are about some of that brain development and about putting weight on the baby just chunking up. So the build up for the baby is putting on stores, like fat stores that are going to help keep the baby warm when the baby comes out. It's also going to give the baby a little bit of a storage for the baby who's going to be breastfeeding. So when you're breastfeeding, you've got that colostrum first, but the colostrum is very small. And so it doesn't most babies are all going to lose weight. In fact, all babies are going to lose some kind of weight. Breastfed babies tend to lose a little bit more in the first couple days as things kind of pick up. So those last couple weeks, that bulk up helps them to be able to manage that. Now, the other thing, the brain development. Now, it's still going to happen outside of your belly. It's not like it doesn't happen, but that brain development has to deal with suck swallow coordination, and it also has to deal with temperature regulation. So these babies who are born at 37 weeks, they oftentimes do not feed well, and they don't seem to be able to figure that out. They often get very cold, they'll have sugar problems, etc. So let me explain a little bit more because I think this is important. Human beings take this for granted. When a giraffe gives birth to their baby, that baby gets up and walks away. Okay? That is still a baby giraffe. That baby giraffe can walk away. Human beings, when we give birth at 40 weeks, our babies are actually premature. They're actually premature because in the wild, that baby wouldn't survive without a mom. It's when they get to a year that they're actually where that newborn baby giraffe is. But human beings can't give birth to a year-old, like a toddler. So we have to give birth to this ultra premature baby. So at 40 weeks, you're talking this is a premature baby in the scheme of mammals. Now, take 4 weeks off of that. And so this is why it's so important that we keep these babies in for as long as possible, because every bit of development helps them to be able to do better on the outside. Hope that helped. I'm 21 or 22 weeks, and my doctor says one thing while my ultrasound tech says another, but I'm feeling my baby more now is very active. Is this normal at this time? Okay. So ultrasound techs should not be telling you anything. And I'm not sure what they're telling you, but if they're just telling you might be 21 weeks or you might be 22, don't worry about that. Ultrasound can be off. 1 week is not going to matter here or there. So if that's what you're talking about, I wouldn't worry about that at all. Feeling the baby move is exactly what we want to feel. So that all sounds good. If the baby's moving around, that's the most important thing. But as far as your dates, it can be off. Ultrasound can be off, and that has nothing to even do with the tech. It's just not a great technology even now. Renee, I'm 37 weeks on Saturday and I'm already hurting. So I hope everything is okay if he comes at 37 weeks. Listen, he will be okay. He will learn how to eat better. He will learn all that stuff. But if he has a little bit of trouble in the beginning, if you want to breastfeed, you may need to work with a lactation consultant and you may plan on pumping a little bit to help stimulate your breasts. If you're going to formula feed, just understand you may have a pokey feeder who doesn't want to eat as well as everybody else. And then the rest of it, we just kind of monitor them while they're in the hospital and we see how it goes. I mean, plenty of 37-week babies go home and they're fine. They're a little bit more undercooked and they just need a little bit of extra time to get those last little pieces together. So should be okay. Okay. So the last two things that I have, and you guys can keep asking questions or anything in the chat, but I actually had two different comments from what appear to be dads. And I love this, so I wanted to save this. So the first one actually came in on my sex video. I'm very big proponent of good sex during pregnancy and good sex postpartum. So I have a lot of videos on that. So he wrote, I'm a guy and I'm wondering if it's normal not to want to have sex at all during this time. My girlfriend is 4 months pregnant and her drive is through the roof, but I'm very anxious about it. So I try not to touch her at all. Any pointers would be welcome. So I loved this comment. I loved that this person was willing to put this out there. So it is actually extremely common for partners to be very, very anxious about sex. We hear that, this kind of reversal, I'm going to use gender roles. Sorry, it's the best way for me to do this because this is what we hear. But we hear all the time, the woman doesn't want to have sex because she's tired and she's pregnant and she's big, and the guy just wants to have sex all the time. And that's actually not very that stereotype is not very true, and it's really unfortunate that it's out there. A lot of times women will have an increased drive in their second trimester, and so both people get to enjoy a really great experience. They have this equal connection. But then you have both sides of it. And so there are a fair amount of men who don't want to have sex with their partners when they're pregnant. They're worried about hurting the baby. They're worried about infection. They may actually not be attracted to their partner. And that's a really, really scary thing to say to somebody. So once you become pregnant, what it is it's not that they're not attracted, like you don't look good. Oh, you're fat. I mean, I suppose that can happen, but it's more often that they all of a sudden look at their partner as a mom. And you don't necessarily want to have sex with your mom. So that's icky. And that's why they get turned off. As far as anxiety, people get worried that they're going to touch the baby, that they're going to put pressure on the baby, something like that. Babies actually like sex. Okay. So babies love sex because when you have an orgasm, it actually causes the uterus to kind of contract a little bit. And it's like a massage for them. So they really actually don't mind it. It's kind of cool for them. Now, if you are that partner who's anxious, one of the most important things is to tell your partner what's going on. You want to be open and honest about it. If you really aren't comfortable, maybe you can be with her while she masturbates, or maybe you guys can just have makeout sessions. Just kind of talk about what is your comfort level. And it's just a really good place for you guys to have a dialogue, but it's very, very normal to feel that way. I've been breastfeeding my 17-month-old the whole time since I've been pregnant. Is it okay? I'm trying to get him off breastfeeding before the baby comes home, and I have 1.5 weeks. Okay. So I'm going to tell you right now that at this point in time, you have like 1.5 weeks. You probably don't want to stop breastfeeding that toddler, because that toddler is going to associate stopping breastfeeding with a new baby. And that is not going to be a great thing. So you can breastfeed while pregnant. I actually have a video on it. And it's very common, and a lot of people do it. However, this is your biggest thing. Your milk is very likely to turn back into colostrum right when you have the baby, if it hasn't already. Your 17-month-old might just be breastfeeding for like comfort. So once it's colostrum, that baby needs to be the first priority. So you need to actually let the newborn eat from both sides before you offer the breast to your 17-month-old. In addition, once your milk comes in, you need to make sure they're swapping breasts. They cannot, so you can actually breastfeed both of them at the same time, one on one breast and one on the other. But the next feeding, they need to switch. You cannot have them eating off of one breast alone and never switching to the other side, because one of your breasts is usually a better producer than the other one. It is okay to tandem breastfeed. That's what it's called. And a lot of people do it all over the world. Now, as far as stopping at this point in time, a week and a half is probably not enough time for a 17-month-old to understand that we're done and we're like completely done. But that kid, your baby, is going to see their little brother or sister eating, and they're going to remember that part, and that is going to be a recipe for disaster. So, Renee, I would encourage you to continue to breastfeed at least for a couple more weeks. And then you might be able to start talking to your older child about how that's just for little babies, that they're a big kid now. But in the next couple weeks is probably not a great idea, because he's very likely to resent the new baby. So I hope that helps. Please feel free to put any of your questions into the chat, because I only have one question left. But that's okay. We can end early if nobody's got questions. So this one came in on my postpartum depression in fathers. It's a comment. So I'm a psychiatric nurse practitioner, and I actually went into psychiatry from working in the hospital and maternity and all that stuff, because I saw that men and women were not getting the help they needed for their mood disorders. And so one of the things that I definitely noticed was that dads needed a lot of help and support. So part of my doctoral project was actually on postpartum depression in fathers, because it's a real thing. So up to 10% of dads will get postpartum depression on their own. And 50% of dads will develop postpartum depression if their partner has postpartum depression or anxiety. And so this is a real problem, because if you've got two depressed parents, like, where is this going to go from here? So this dad wrote, my wife gave birth to our third child on August 24th. And this is the first time I've experienced postpartum depression. Every little thing makes me want to break down in tears, and I don't know why. Suddenly, I'm overwhelmed with the fear of getting old and dying while my children are still young. I'm working through it, but it's very tough. And this is so amazing that this dad was willing to put this out here for us to hear about. So dads can absolutely experience this. They tend to be very worried about bigger picture items. And this is why sometimes they won't be so helpful on the day-to-day little details. It's not that they don't want to, but they don't think it's as much of a big deal to say clean the bottles when they're worried about whether they have enough life insurance. Okay. And I know that sounds crazy, because in the day-to-day, you need diapers changed and bottles cleaned, right? But that's the thing. They carry this burden about the bigger picture. And I think part of that's because of our society. I mean, the reality is most of the time, women are the ones who stay home if they're going to stay home, and men are the one that go back to work, because this is just how our society has been created. Don't agree with it, but this is kind of where it's at. Women are definitely going to be at home for 6 or 8 weeks recovering, hopefully, which means men are going back to work, and they have to go back to work like right away. They usually don't get paternity leave, nothing. And so this creates this idea, this like subconscious idea, like everything's riding on you. You have to do this. Your family is going to starve without this. And so it's very important for them to be successful. And then they start to understand, well, wait a second, if my partner's not working, even if it's for the 6 weeks, what is going to happen to my family if I'm not here? So they get this weight on their shoulders, which can really drag them down. And then there's just all the minutia, the day-to-day stuff. The day-to-day is very, very hard. And what a lot of people don't talk about, and I hear it all the time in my practice, is people don't talk about the regret. They don't talk about these babies come out and they're in the midst of newbornhood where nobody sleeps and everything's a mess and it's complete chaos. And they're like looking at this going, why did I do this to myself? Like, I wish I could bring this baby back. And that's okay. You don't actually want to do that. You're going to be the best parents ever. But in the moment, it's okay if you're not really liking what's going on. And if that's happening day after day, it can wear on you as well. And again, it's not because you're a bad parent. You will always still be this good parent, right? But you can also not like it that you can't go take a shower when you want anymore. That's cool. So this is one of the complications, because then, especially for guys are expected to be strong. What is he supposed to do? Is he supposed to tell people that he's feeling depressed and sad and anxious? I mean, more and more people are normalizing this, which is amazing, but a lot of people are stuck with that narrative. The other thing is, and this is something that's a sensitive subject, but we have created this idea that giving birth and postpartum is all about the mom, that everybody's supposed to be focused on the mom and the baby. Do whatever she needs to do. I totally think that needs to happen. But dads need help too. And we need to support dads. We need to support the entire family unit. And a lot of times when a dad is struggling, they are afraid to tell their partner because they think they look selfish. And the thing is, when you ask for help, it is kind of selfish, but it's the selfish that we're supposed to do. We're supposed to be selfish enough to ask for help when needed. And so it's complicated for a dad because if his partner is like recovering from surgery and there's 2 kids to take care of and there's been complications after birth, like, how does he manage that? So I just think it's very important. If you are outside of these brand new families that are being created, when you see your friends and family having new babies, support them however you can because they need it. Try to create opportunities for both of them to get out without kids for self-care because that is essential. So I was so glad this dad wrote this and I wanted to talk about it. So can autism, ADHD, and any other cognitive developmental issues be detected from the womb through an ultrasound? Or there has to be a more in-depth assessment after birth? Oh, absolutely, after birth. You cannot detect any of those things in utero. Those are all 3 extremely complicated conditions. So I'm actually this kind of good. So I have a child with autism, so very familiar. And I actually have a certification, or I'm in the middle of a certification, for ADHD. I'm also going to be doing an autism certification as far as medicating for those 2 conditions. So I'm actually very familiar with those 2. So these are things that develop over time. These are not things that are noticeable right away. The only cognitive issues that you might sort of diagnose would be if you could find out that a baby had like a genetic disorder. There's genetic tests they'll do that could cause those issues, but that's it. You can't really go beyond that. Now, the one thing I am going to tell you, ADHD is usually screened later on when a kid's getting into school and they're more hyperactive and they're not able to focus. That's when they go to their doctor and they get screened. But autism. So it is very important for parents to know all of this, or to know this. So the CDC recommendation is if your child does not respond to their name, have them screened for autism and get a hearing screen. Okay. So this means you're walking up to your baby, but not straight on, from behind, from the side, and your baby's maybe like 7, 8, 9 months old, and you say, "Hey, Tommy," and they don't look at you. They don't respond to that. Then that is a warning sign. When our child got diagnosed, here's what happened. He, up until 12 months old, everything was like kind of this normal story. He was walking and talking. He had lots of words, like 30, 40 words. I mean, he was stringing 2 words together. So there was a lot of development. And then he had a ear tube surgery and a couple other things during the 13th month. And all of a sudden things changed. Okay. And so during that month, lots of stuff changed. And at first, we didn't really notice it. When you're with somebody day to day, you don't notice subtleties. But it was our family members who said to us, did they mess up his hearing because he's not responding anymore? It doesn't seem like he can hear. Well, our pediatric ENT always did hearing screens before and afterwards. So we had already done that and we knew the hearing screen was normal. So once our family was telling us he wasn't responding, and yet we knew there was a normal hearing screen, that's what clued us in that something was different. It was at that time that we started to actually realize he had lost all of his language. All of the words that he had said were gone. And in fact, those were the words that were hardest for him to get back. We didn't actually hear like mama or dada for almost another 2 years. So it was extremely challenging. So what did we do? We went to the pediatrician. We said, give us a referral. We went through early steps. They did a complete evaluation. They figured out that he was at minimum developmentally delayed. We got into speech therapy, occupational therapy, and physical therapy. Now, I always tell people, and please, guys, tell everybody, if you think there is any chance of any possibility of there being a problem, go get your kid evaluated. All of these therapies, it's play. That's all it is. It's puzzles and colors and bubbles and shapes. I mean, it's actually like amazing that you can take these things and turn it into like development. So we were told that our son was never going to walk. And I say walk, I always say walk, talk, and potty train. My husband pointed out to me recently that he was already walking. So that's true. But he was never going to talk again. He was never going to jump or run or ride a bike. He was never going to do any of that stuff. We were actually recommended, he was diagnosed at 13 months, and we were recommended to get start financial planning for nursing home care. That's what they told us about our 13-month-old. He is currently on his way to getting a regular college diploma. Regular, no accommodations. He's a regular kid. And so that's what the reason why that is, I'm 100% believe the reason why that is because we made sure to get him into every therapy they recommended. If there was a therapy out there, we did it. We did physical therapy, speech therapy, ABA therapy, occupational therapy, everything we could possibly do. The other thing is that I am very homeopathic. I say this a lot. It came from my son. My son, as he was growing up, had a regular mainstream pediatrician, and he had an alternative medicine pediatrician. So we actually approached his care from a completely holistic way. So I hope that answered the question, but unfortunately, these conditions are not going to be diagnosed until later on. That's the earliest it can. But again, if any of your friends and family are like questioning a child's development, get it checked out. It is so like life-changing for these kids. The earlier they get it, the better it is for them. Oh my gosh. Hi, Gabriella. Oh, thank you so much. She's saying congratulations. I don't know if you guys can see each other's comments, but she's saying congratulations and thank you for sharing. No, it's absolutely we're very much very open about that. First of all, because like who wouldn't be like proud? But more importantly, I think a lot of people don't get their kids screened or like get into like therapies because they feel like this like stigma about it, like there's something wrong with their kid. So let me tell you, when my kid was going to get his evals, the running joke was during the evaluation, we wanted him to get the worst score ever. So I would give him candy, keep him up at night. You guys might be like, why? Well, the worse he did on evaluations, the more therapy my insurance would approve. But then the rest of the time, that's when I wanted to hear good news. And that's some of the things that I learned along the way. But there's no shame in getting these interventions because our brains need to learn how to learn very early on. What's actually one of the most critical things in your child's development is teaching them how to learn, letting the brain figure out how to get those processes, build all the connections, all that good stuff. We continue to learn throughout our lives. We will learn new stuff when we're 99, but we had to teach our brain how to learn. And that happens very, very early on. And for kids who don't receive early intervention, as time goes on, it becomes harder and harder to establish those pathways, which is why it's so essential to get them treatment fast. So I'm done with my questions. If you guys have any more questions, please feel free to put them into the chat. I am here every Monday at 9 p.m. Eastern Standard Time answering your questions. Please feel free to put questions and comments onto the videos. We always check them out. I love getting them. I love being here. Remember, share the channel with your friends and family. Follow me on Facebook and Instagram for additional content. I promise there will be videos coming out, guys. It's just been a rough month, I guess, summer and then, whatever. So, but there are videos coming out. There are 3 scripts in the works. But we do have other content and we're going to continue to be here as much as we can. I really appreciate all of you. I'm going to say goodnight. I'm Dr. Samantha, the maternity mentor. Thank you for all you guys who've come back. I'll talk to you later. Bye for now.